All right, welcome to another deep dive with us.
Yeah, thanks for joining us.
We had a really interesting set of information sent in this week all about Turner syndrome.
Yeah, it's a fascinating topic.
Now we know that going into the world of chromosomal disorders can sometimes feel a little bit like you're, trying to decode a super complex puzzle or something.
Right.
But our aim today is to really break this down for you and make it clear and easy to understand and highlight some of the things that really stood out to us as we were reading through this material.
Yeah, exactly. We want to kind of give you a guided tour through some of the essential information on Turner syndrome.
Right, and what it really means for those who are affected by it.
Yeah.
We're working from a collection of medical and informational sources that you guys sent to us.
That's right.
And as we went through these sources, something that became very clear is that Turner syndrome isn't really a straightforward one-size-fits-all kind of diagnosis.
Right, yeah, absolutely. And that variability, I think, is really one of the more interesting things that we found
Yeah.
in preparing for this.
So let's start at square one.
Right.
What exactly is Turner syndrome?
Okay, so at its core, Turner syndrome is a chromosomal disorder, and it affects females specifically. And it's characterized by a partial or complete absence of one of the two X chromosomes.
Oh.
So instead of the usual two X chromosomes, there's either just one
Right.
or there's one that's incomplete.
So like the blueprint is missing a piece?
Exactly. It's like a blueprint's missing a piece, and that absence is what we refer to as monosomy.
Okay, so monosomy means there's only one.
That's
Or part of one.
Yeah.
And the sources gave some information on how common this is.
Right.
So how often does this occur?
So it's classified as a rare disorder, but interestingly, it's likely the most common genetic disorder that affects females. It affects approximately 1 in every 2,000 to 2,500 live female births.
Wow.
So it's rare, but still the most common.
Right.
Yeah.
So in the United States, it's estimated that over 70,000 females have Turner syndrome.
Yeah. So that really highlights the prevalence of it, even though it's considered rare.
So that's a lot of people.
It is, yeah.
And does that mean that there is a lot of research on this?
There's ongoing research, and we'll talk about that a little later.
Okay, we will get into that later.
Yeah.
Now, you mentioned the name Turner syndrome. Where does that name come from?
It's named after Henry Turner, who first described a set of characteristic features back in 1938 in the medical literature.
Okay.
And so you might come across other names for it, like 45X syndrome,
Right.
which refers to the fact that these individuals usually have 45 chromosomes
Got it.
instead of the usual 46.
Okay.
You might also see it referred to as Bonnevie-Ulrich syndrome, monosomy X,
Right.
and Ulrich-Turner syndrome.
So there are quite a few names floating around.
There are. Yeah, it's good to be aware of all of them.
Yeah, good to be aware of that.
Right.
So is this something that's typically passed down through families?
So the vast majority of Turner syndrome cases actually occur sporadically,
Okay.
meaning that they happen randomly.
So it's not like you inherit it from your parents.
Exactly.
Yeah.
And it's usually due to errors that happen during the division of a parent's reproductive cells.
Okay.
Either the sperm or the egg.
Got it.
Or very early on in fetal development.
Okay, and there is the term mosaicism.
Right.
What is mosaicism?
Mosaicism is really interesting because it describes a situation where only a certain percentage of cells in the body are affected by this missing X chromosome.
Okay.
So some cells might have the usual 46 chromosomes,
Right.
while others have that missing X.
Okay.
So it's like there's a mix of different genetic makeups within the same individual.
Oh, it's like a patchwork.
Exactly, the patchwork of cells.
So does that affect, like, how the syndrome presents itself?
In theory, it does because you have fewer cells that are affected.
Right.
Individuals with Turner syndrome mosaicism might, on average, experience fewer developmental problems. However, it's really tough to predict specific outcomes for any given person
Right.
because it really depends on which cells are affected and to what degree.
Got it.
Yeah, so it really just kind of underscores how complex this can be
Right.
and how much we still don't understand about how genes actually get expressed.
It's really interesting.
Yeah.
And there are some other causes that we read about in
Right.
addition to just the complete or partial loss of an X chromosome.
Yeah, so in addition to the kind of more straightforward loss of an X chromosome, Turner syndrome can arise from some other structural changes to the X chromosome.
What are some of those?
So one is called a ring chromosome,
Okay.
and that's where the ends of the X chromosome break off, and then they join together to form a circular structure.
Oh, wow.
Another one is called an isochromosome X,
Okay.
and this is where one arm of the X chromosome is missing. and is replaced by an identical copy of the other arm.
Oh, so it's like mirrored.
Exactly, yes, like mirror.
Okay.
So those are less frequent
Right.
than the complete or partial loss, but still important to understand as potential causes.
Okay, so we have these different ways that this can kind of manifest at the chromosome level.
Yeah.
But what about the presence of a Y chromosome?
Right, so in some cases, individuals with Turner syndrome might also have a mix of cells,
Okay.
where some contain a single X chromosome,
Right.
and others contain an X chromosome along with some material from the Y chromosome.
Okay.
And even though this isn't usually enough to cause the development of like male physical characteristics,
Right.
the presence of that Y chromosome material is linked to a higher risk of developing a tumor called a gonadoblastoma.
That sounds serious.
It can be, and so doctors often recommend removing any non-functioning gonadal tissue in these cases.
Okay, so that's something to be aware of.
Yeah.
So we've covered a lot of the genetic basis of Turner syndrome,
We have,
but let's get into how it actually shows up.
right?
So what are the signs and symptoms of Turner syndrome?
So it's really important to understand that individuals with Turner syndrome may not exhibit all of the signs and symptoms that
Okay.
we're going to talk about.
Okay.
And the degree of severity can also vary a lot from person to person.
Okay.
So it really is a spectrum,
Yeah.
which really highlights the fact that every individual's experience with this is unique.
Right, and that came up a lot in the sources.
Yeah, for sure.
So let's start with growth and puberty, since those seem to be like the most commonly affected areas.
Yeah, so almost all individuals with Turner syndrome experience some degree of growth failure,
Okay.
which often results in a final adult height that's shorter than average,
Okay.
usually under 5 feet.
Got it.
If untreated, and interestingly, children with Turner syndrome might initially grow at a pretty typical rate for the first few years of their life.
Okay.
However, as they get older, their growth velocity tends to slow down. And they typically don't experience that big growth spurt that happens during puberty.
Got it.
Yeah.
And puberty itself is also affected a lot of the time.
It is. Yeah, another common characteristic is what's called premature ovarian failure,
Okay.
which is also known as gonadal dysgenesis.
Right.
And basically, the ovaries don't develop properly.
Okay.
And so they're unable to produce the vital hormones,
Function?
like estrogen, like progesterone,
Yeah.
that are needed for puberty and the development of female characteristics.
And when does that usually occur?
This often occurs very early on,
Okay.
sometimes even in childhood.
So what happens when those hormones aren't being produced?
So in those situations, most affected females will need hormone replacement therapy.
Right.
And that's typically started around the age of 12 to 14.
Okay.
And it helps to induce puberty
Okay.
and the development of secondary sexual characteristics.
Like breasts.
Yeah, like breast development and, normal female body contours.
Yeah.
It also helps with bone growth
Okay.
and to begin menstruation.
So it's really important.
It is, and it's
Cool.
usually a long-term thing, often continuing until menopause.
Okay.
Now, it's important to note that some individuals
Mm-hmm.
might actually experience some initial pubertal development
Okay.
and even start menstruating on their own. But this often stops later on in their teenage years or early adulthood. Yeah, because of that, infertility is very common.
Okay.
Yeah.
So hormone replacement therapy is really critical for a lot of people with Turner syndrome.
Yeah, absolutely it is.
What about intelligence and learning?
So one of the more reassuring things we found is that intelligence is usually in the normal range.
Okay.
For those with Turner syndrome, however, there are some individuals that experience specific learning disabilities,
Okay.
particularly involving visual spatial relationships.
So like what kind of things?
So things like distinguishing right from left
Mm.
or understanding directions, maybe learning mathematical concepts, things like nonverbal memory and maintaining attention
Okay.
can sometimes be difficult.
Got it.
And there can also be some challenges in social situations.
Okay. So there can be subtle impacts.
Yeah, and it's really interesting to see how those are linked to the chromosome difference.
Right.
Yeah.
It is fascinating.
Yeah.
And there are also some distinctive physical features
Right.
that are sometimes associated with Turner syndrome.
There are. And again, it's important to remember that not every individual
Right.
will have all of these.
Yeah.
And the prominence can really vary.
Okay.
But they can include a shorter neck that may have a webbed appearance,
Okay.
a low hairline at the back of the head, ears that are set a little lower than usual.
Right.
The fingernails and toenails might be narrower than usual
Okay.
and tend to curve upward.
Right.
Some individuals might have a broader chest with nipples that are more widely spaced,
Okay.
sometimes referred to as a shield chest.
Right.
And there can be swelling or puffiness in the hands and feet
Yeah.
due to lymphedema.
And that came up a lot.
Yeah, and that's basically a buildup of lymphatic fluid.
Right. So the lymphatic system is really important.
It is, yeah.
And are there other kind of more subtle physical features as well?
Yeah, so other features can include a receding lower jaw,
Okay.
eyes that cross, which is called strabismus,
Okay.
or lazy eye, which is amblyopia,
Right.
drooping eyelids, or ptosis,
Yeah.
and a narrower, higher arched palate in the mouth.
Interesting.
Yeah.
What about like the skeletal system?
So skeletal variations are also possible, such as shorter bones in the hands, particularly the fourth metacarpals,
Okay.
and sometimes arms that turn outward at the elbows,
Okay.
and flat feet, also known as pes planus.
Okay.
And then there's scoliosis.
And that's a curvature of the spine.
That's right, an abnormal sideways curvature of the spine.
Yeah.
And that can occur in about 10% of individuals with Turner syndrome.
Okay.
So it's really quite a range of potential features.
It is.
Yeah.
And what about the heart?
Yeah, so congenital heart defects are a recognized association with Turner syndrome,
Okay.
particularly in individuals who also have that lymphedema that we talked about.
Right. And one of the more common issues is a bicuspid aortic valve.
And what is that?
So that's where the aortic valve only has 2 leaflets instead of the usual 3,
Okay.
which can then affect how blood flows out of the heart.
Okay.
And another one is coarctation of the aorta.
And what is that?
So that's a narrowing of the main artery that leads from the heart.
Hmm.
And so that narrowing forces the heart to work harder,
Got it.
to pump blood through the body.
So that can lead to some problems.
Yeah. And the symptoms of coarctation can range from very mild to quite severe.
So what kind of things?
It could be pale skin, irritability, excessive sweating, difficulty breathing,
Okay.
and in serious cases, it could lead to heart failure.
So those are some serious health implications.
Yeah, they can be.
And the sources mentioned some pretty serious potential complications from these heart defects.
Yeah, absolutely. So some of the things they mention are pulmonary hypertension.
And that's high blood pressure in the lungs.
That's right, high blood pressure in the arteries of the lungs.
And another is aortic dissection,
And what's that?
which is a tear in the inner wall of the aorta.
And that sounds dangerous.
It is, yeah. It can be very dangerous.
And there were some specific genes mentioned.
Yes, TIMP3 and TIMP1.
And those are related to...
Researchers believe those may play a role in the development of bicuspid aortic valve and other aortic abnormalities in those with Turner syndrome.
So we're learning more and more about the specific genetic links.
Yeah, absolutely. And that's one of the exciting areas of research right now.
Right.
Is really pinpointing those genes
Yeah.
that are involved.
Okay, so what about the kidneys? Are they sometimes affected?
Yeah, kidney abnormalities can occur in some individuals, including a horseshoe kidney.
And what's that?
So that's where the 2 kidneys are fused together
Okay.
in a U shape, or in some cases, the complete absence of one of the kidneys.
And what are the implications of that?
So those structural differences can increase the risk of urinary tract infections and the development of high blood pressure or hypertension.
Okay, so there are a lot of potential impacts on different organ systems.
Yeah, there really are.
What are some other common health issues we should be aware of?
So a couple of other noteworthy ones are liver abnormalities like fatty liver,
Okay.
and thyroid disease is also more common.
And we talked about the thyroid earlier.
We did. And specifically, it's hypothyroidism that often results from Hashimoto's syndrome.
Right. And what is that exactly?
So that's an autoimmune condition where the body's immune system attacks the thyroid gland. And the symptoms of hypothyroidism can be varied.
Like what kind of things?
Fatigue, muscle aches, and dry skin. There's some common ones.
And you mentioned some skin issues as well.
Yes, some individuals develop multiple small pigmented spots on their skin called navy.
Right.
But these are not associated with a higher risk of skin cancer.
Okay, good to know.
Yeah.
And what about the ears?
Yes, so there's an increased susceptibility to middle ear infections, also known as otitis media,
Right.
especially during childhood.
And what kind of problems can that lead to?
Well, frequent ear infections can sometimes lead to conductive hearing loss,
Right.
which happens when sound waves are blocked from reaching the inner ear.
Okay.
And although that type of hearing loss often resolves as children get older,
Right.
it could definitely impact their speech and language development.
Yeah, if they're not hearing properly.
Exactly.
Yeah, makes sense.
Yeah, and then in adulthood, there's a chance of developing sensorineural hearing loss.
And what is that?
So that's damage to the inner ear or the auditory nerves.
Okay.
And that type of hearing loss may gradually worsen with age.
Hmm. And there were a few other conditions that were mentioned.
Right. The sources also indicate a higher risk of developing things like diabetes, celiac disease, and osteoporosis.
And osteoporosis is a weakening of the bones.
That's right. It's a reduction in bone density that can increase the risk of fractures.
Right. And there were some gastrointestinal issues mentioned as well.
Yes. Things like feeding difficulties in infancy and gastroesophageal reflux can also occur.
So really, it can impact a wide range of things.
Yeah, it really underscores how multifaceted this condition is.
Right, yeah. And it shows how important comprehensive and ongoing medical care is.
Absolutely, yeah.
So we've talked about the what in terms of symptoms.
Right.
Let's go back to the causes.
Okay.
We know it involves a missing or incomplete X chromosome.
Right.
But what else did the sources say about that?
So we know that that's the primary cause.
Right.
And as we discussed, it usually happens randomly.
Right.
But researchers are working to better understand the specific genes on the X chromosome that contribute to all the various features of Turner syndrome.
And we talked about some of those specific genes earlier.
Yeah, like the SHOX gene,
Well,
which
yeah.
is strongly linked to short stature and skeletal findings.
Right.
And the UTX gene, which is thought to be involved in that susceptibility to ear infections. And then the TMP3 and TMP1 genes, which are linked to those heart issues.
So there's still a lot we don't know about the exact mechanisms involved.
Yeah, it seems like we know the broad genetic cause.
Right.
But those precise mechanisms that lead to all these different symptoms are still areas of active research.
So how is Turner syndrome usually diagnosed?
So usually a doctor might suspect Turner syndrome in a girl who has growth deficiency or short stature
Right.
that they can't explain.
Okay.
And they would do a detailed medical history
Okay.
and a physical examination.
Right.
But the definitive diagnosis is made through chromosomal analysis,
And that's usually done with a blood sample.
usually a blood sample, yeah.
Okay.
And they do what's called a karyotype.
And what is that?
So a karyotype is basically a visual map of someone's chromosomes.
Okay.
So you can actually see if any of are missing or abnormal.
Got it.
And it's not just after birth, right?
Yeah, the sources talked about prenatal diagnosis.
Right. So prenatal diagnosis is becoming increasingly common. And so there are screening tests that can be done during pregnancy using a maternal blood sample.
Okay.
And that can sometimes indicate a risk for Turner syndrome
Okay.
and other chromosomal abnormalities.
And if that screening test shows a higher risk, what happens then?
Then they can do more definitive diagnostic testing.
Okay.
And that usually involves either chorionic villus sampling, which is called CVS,
Right.
or amniocentesis.
And when are those done?
So CVS is usually done in the first trimester,
Okay.
and it involves taking a small sample of placental tissue.
Got it.
And amniocentesis is done in the second trimester.
Okay.
And they take a sample of the amniotic fluid
Right.
that surrounds the developing fetus.
And those both allow for like a more in-depth look at the chromosomes.
Exactly.
And the sources also mention ultrasounds.
Right, so sometimes routine ultrasound scans during pregnancy can also raise the suspicion of Turner syndrome.
And what kind of things would they be looking for?
So things like an accumulation of lymphatic fluid in the neck region of the fetus can sometimes be a sign.
Okay.
But it's important to understand that even if a prenatal test confirms Turner syndrome, it can be hard to predict the full extent of the symptoms the baby will have after birth.
So it doesn't always tell the whole story.
Right, it gives information, but not always the complete picture.
Right. So once Turner syndrome is diagnosed, what are the standard therapies and management strategies?
So the management of Turner syndrome is really focused on addressing the specific symptoms
Okay.
that each individual has.
Right.
And it usually requires a team of specialists,
So like her.
pediatricians, endocrinologists, cardiologists, and various others.
So it's really important to have that team approach.
Yeah, absolutely. And while there isn't a cure for Turner syndrome,
Right.
the therapies can really help
Right.
improve physical development and allow these individuals to lead full and productive lives.
And one of the key therapies that we read about was growth hormone therapy.
Right. Growth hormone therapy is often a central part of the treatment.
And that's used to.
Well, it uses a lab-produced version of the natural growth hormone our bodies make.
Okay.
And it can be very effective at helping individuals with Turner syndrome achieve a height that's closer to average.
When is that usually started?
Generally, the earlier it started in childhood, the better the outcomes.
Okay.
But the best timing and dosage really needs to be determined by a pediatric endocrinologist.
Right, because everyone's different.
Exactly. Yeah.
And we also talked about hormone replacement therapy.
Right. So most females with Turner syndrome will need estrogen and progesterone replacement therapy.
Okay.
And that usually starts around age 12 to 14.
And that's to help with?
It's to help induce puberty,
Okay.
promote the development of those secondary sexual characteristics,
Right.
support bone health, and initiate menstruation.
So that's really important.
It is, and it's usually continued long-term,
Okay.
often until the age of menopause.
Okay, what about fertility? Is that usually affected?
Yeah, unfortunately, because of that premature ovarian failure, most individuals with Turner syndrome are unable to conceive naturally.
But are there any options?
There are some options. So one is in vitro fertilization, or IVF,
Right.
using a donated egg,
Okay.
and then the woman with Turner syndrome carries the pregnancy.
Got it.
Another possibility is egg cell preservation,
And when would that be done?
ideally at a young age,
Okay.
to potentially use those eggs in the future.
Right.
But it's important to note that pregnancies in individuals with Turner syndrome do carry some medical risks.
Okay.
So they need to be closely monitored by doctors
Right.
who specialize in high-risk pregnancies.
So it's not something to be taken lightly.
No, not at all.
And we mentioned the management of Y chromosome material earlier.
Right. So for those individuals who have any Y chromosome material, it's usually recommended to surgically remove the non-functioning gonadal tissue
And that's to
reduce that risk of developing gonadoblastoma that we
Right.
talked about.
Okay, so are there any other treatments or support that are typically provided?
Yeah, a big part of management is addressing the individual symptoms and providing supportive care.
Okay.
So things like thyroid hormone replacement therapy for those who develop hypothyroidism,
Okay.
hearing aids for managing hearing loss,
Right.
and then early intervention services.
So like what kind of things?
Things like psychosocial support
Okay.
to help with any emotional or social challenges,
Right.
and speech therapy
Okay.
if there are any communication difficulties.
And are regular checkups important?
Absolutely, they're crucial
Okay.
to make sure any developing health issues are caught and managed early on.
Yeah, that makes sense.
Yeah.
Are there any other conditions that might have similar symptoms to Turner syndrome?
Yeah, there are other conditions that can share some features.
Okay.
And one example is Noonan syndrome.
Okay, and what's that?
It's another genetic disorder.
Okay.
They can sometimes present with things like short stature and a webbed neck.
So similar to Turner syndrome.
Yeah, similar to some of the things seen in Turner syndrome.
Okay.
And in the past, it was sometimes referred to as male Turner syndrome
Right.
or female pseudo-Turner syndrome.
Got it.
But it's really important to note the differences.
Okay, so what are they?
Well, Noonan syndrome affects both males and females,
Okay.
and it involves a normal set of chromosomes,
Okay.
whereas Turner syndrome only affects females and involves those abnormalities of the X chromosome.
Right.
And they're also caused by different gene mutations.
Okay, so they look similar, but they're different.
Exactly. Yeah.
So
So it's important to understand that distinction.
Got it. So lastly, I want to touch on the research aspect.
Right.
Are there a lot of studies being done on Turner syndrome?
Yeah, there's a lot of research going on
Okay.
to better understand it,
Right.
refine those diagnostic methods,
Okay.
and develop more effective treatments.
So there are clinical trials happening.
Yes, there are lots of clinical trials and research studies being conducted.
And are there resources available for people who want to learn more?
Absolutely. So some good websites are clinicaltrials.gov,
Okay.
the NIH Patient Recruitment Office, rarediseases.org,
Right.
centerwatch.com, and the European Clinical Trials Register.
Okay.
So those all have information about current trials.
Great. And we've included contact information for a specialist at Johns Hopkins All Children's Hospital.
Yeah, we have.
So to wrap up this deep dive,
Right.
what would you say is the most important thing for people to take away about Turner syndrome?
I think the most important thing is that while Turner syndrome is complex
Hmm.
and can have a wide range of effects,
Sure.
with the right medical care and support,
Okay.
individuals with Turner syndrome can lead full and productive lives.
Yeah.
Early diagnosis and individualized management
Right.
are key.
That makes sense.
Yeah.
And it's amazing how much we've learned about the genetic basis of this,
Yeah.
but there's still so much variability
Right.
in how it presents.
It really highlights how complex the relationship between our genes and our development is,
Yeah.
even for those without a specific diagnosis.
Right.
I mean, it makes you think.
It does.
When you consider how one missing or altered chromosome can lead to so many different effects
Yeah.
across the body,
Right.
it really makes you appreciate the complexity of human biology.
It really does, and it makes you wonder how much more we have yet to discover.
Yeah, absolutely.
So if you want to learn more about this topic, definitely check out the resources that we've included in the show notes.
Yeah.
And as always, if you have any medical questions or concerns, please reach out to a qualified healthcare professional.
That's right.
Thanks for joining us for this deep dive.
Thanks for having me.
We'll see you next time.
See you later.
Bye.